Joined now by one of the public faces of the government throughout this lockdown, the Communities Secretary, Robert Jenrick. Robert Jenrick, the government has dropped its original stay-at-home message and has substituted stay alert. What does stay alert mean?
Well, good morning, Andrew. And at 7 o'clock tonight, the Prime Minister will lay out a roadmap for the next phase of the virus. We've passed the peak, and so we do think this is the right moment to update and to broaden the message. So stay alert will mean stay alert by staying home as much as possible, but stay alert when you do go out by maintaining social distancing, washing your hands, respecting others in the workplace and the other settings that you'll go to. This will be a cautious message because the rate of infection is still high and the public are understandably anxious.
I suppose that this is only for England. Scotland and Wales will keep stay at home as their message.
We would like the whole of the United Kingdom to move as one. That's our strong preference. The Prime Minister will lay out this message for the whole country tonight, but obviously Scotland, Wales and Northern Ireland can choose to take different approaches if they wish to.
Here is why. I mean, Nicola Sturgeon, the First Minister of Scotland, has said on Thursday, for us to drop the clear, well-understood stay-at-home message right now could be a potentially catastrophic mistake.
Well, staying at home will still be an important part of the message. We want people to stay at home as much as possible, but when they do go out, to work or to shop or to look after the vulnerable, to do so by respecting social distancing. And one of your previous contributors said there's no place for nuance. I disagree with that. I think that the public are capable of understanding a broader message as we move into the next phase of the virus. We're going to be living with the virus in one form or another, hopefully declining for some time. So we need a more nuanced message, and that's what the Prime Minister will lay out later today.
Well, already up and down the country, as you have seen, lots of people are ignoring the lockdown. Why do you think that is?
Well, some people are, but the vast majority of people have adhered to the social distancing guidelines, have stayed at home, and that's been very important to the progress that we've made, that we have now passed the peak of the virus, that the rate of infection is reducing within the community. There remains, as you've heard on the programme, a very serious issue in care homes. But I'm grateful to the public for their forbearance so far. And we're hopeful that and confident that this new message will also be abided for and that people will take a vigilant approach in going about their daily lives.
Well, I said lots of people are ignoring the lockdown. Let's just look at the tweet that was put up by the Hackney police in East London. Sadly, we are fighting a losing battle in the parks today. Literally hundreds of people sitting, having pizza, beers, wines. As always, a big thank you to those observing the guidelines. That is the scene from Hackney. And again, I say, why do you think that's happening?
Well, throughout the lockdown measures, you have been able to draw up scenes of particular parks or beaches or locations. These are actually rare. The vast majority of people have obeyed the guidelines, and you see that in the statistics, for example, of the number of people who have been issued with fines, which is low across the country. Overall, the police have been able to maintain the social distancing guidelines during the lockdown by consent, because people have wanted to obey this, and that's important. I do also think that it's important that parks are available, because if we're going to have these measures continuing, we want to make sure they're as livable and as bearable for people as possible.
Sure, but I mean, the Coast Guard, for instance, who look at the coast all around the country, of course, they say people are ignoring the measures put in place by the government. I ask you why, and I'm going to give you a possible answer. Let's just look at Thursday's newspaper headlines. There we go. Magic Monday. Hurrah, lockdown freedom beckons. Happy Monday, lockdown will be eased next week, and so on and so on. Did any government briefing contribute to those headlines?
Well, I don't know. It's certainly not something that I've been involved in, and I hope not. But you and others have been asking for the government to lay out a strategy for the next phase of the virus for some time, and that's exactly what the Prime Minister will do tonight. But I would just stress again, staying at home will remain an absolutely essential element of that strategy, but it will broaden out and will encourage people to stay alert when they're going about their business, when they're going to work, for example, if they have to. And that's important, because if we're going to be living with this for a while, we've got to ensure that people remain socially distanced, wash their hands, take all of those other steps, as well as simply staying in the home.
I showed you, I think, 6 front-page headlines across the national press. You and I have both been around a bit. We both know perfectly well that 6 newspapers would not have put that message on their front page without a clear steer from the government somewhere.
Well, I'm not going to preempt what the Prime Minister will say this evening.
I'm not preempting.
However, this will be a cautious approach. There will be no grand reopening of the economy tonight. There will be a message of caution, of personal responsibility, being vigilant and staying alert. And by doing that, we will help to control the virus. And in time, not today, but in time, we'll be able to gradually reopen the economy and the other aspects of our lives. None of us want to see the lockdown continue for one day more than is necessary. Today isn't the moment to do that, but we will be setting out the plan. And at each stage on that road, each milestone will be conditional upon keeping the rate of infection to a manageable level.
This was disastrous mixed messaging as far as a lot of people in the country are concerned. Your own advisor, Sage, said it's incredibly damaging to have bits and pieces of information leaked. Sections of society may take this as we'll do what we want because it's all changing on Sunday anyway. Once the lid is taken off and people break the rules, they'll be much more likely to carry on breaking them. And that is the response after headlines like that. I ask you about the Prime Minister himself, who said in the House of Commons, we will want, if we possibly can, to get going with some of those measures on Monday. This has not been a very astute piece of messaging, has it?
Well, I think the public will have to tune in to listen to the PM tonight. As I say, he's taking a very cautious approach, which reflects the fact that the rate of infection is still high, particularly in some settings like care homes, the understandable anxiety of the public, and we'll have to give confidence to people to go back to work or to other aspects of life in due course. But the very clear message of the government is that that isn't where we are now. There's still some way to go. And so please be vigilant, stay alert, and by doing that, we'll help to control the virus.
You set this very important target of 100,000 tests a day. Over the last 7 days, for how many days have you hit that target?
Well, we hit it on the date that we said we would and the following day. Every other day, we've fallen just short of it. Capacity is over 100,000, and that's important. We want that to rise to 200,000. I think it is worth saying we've come a long way with this. You know, at the end of I think February we were 2,000, March 10,000, April around 100,000. So we are moving in the right direction, but of course there's more work to do there.
In 7 days you didn't hit it once, and you say capacity is available, in which case why have you had to send 50,000 tests to America to be checked?
Well, those are two different questions. Capacity in terms of having the tests available to test people, that has been available. However, there was an issue with a lab, and that meant that we had to send some of the tests to the United States to be processed and the results brought back to the public. And I think, if anything, that just shows our determination to get the job done. We had a contingency plan. We put that in place as soon as there was an issue with the lab that was otherwise going to be processing the results. And we did that so that the public, who were waiting for the results, could get them as quickly as possible. And that was the right thing to do.
Well, you see, it's two different issues, but a test doesn't mean much unless you can actually read the results properly. So what was the problem with the laboratory?
There was a temporary failure at that laboratory. We've had one with 2 laboratories now, different issues. But in each case, as you'd expect, there is a contingency plan. And this contingency plan, was a very well worked through one. It was to get the test to the United States, have them processed there, get the results to members of the public as quickly as possible.
Carol Ann Doherty, who was one of those people involved in the test, said on yesterday, she just said, still awaiting test results that were collected from us last Saturday. This process is beyond ridiculous. My husband is a key worker who can't work till results are back. This process has been one disaster after another. And Carol Ann is not wrong, is she?
Well, I'm sorry to hear her experience. I don't obviously know the individual circumstances there. I've heard positive feedback, for example, for those people who've gone to the mobile testing sites. We have almost 100 of those now. Their locations are being focused on places that are accessible for care workers, for example, and the experiences that I've heard as local government secretary, people going to those, particularly the ones that are manned by members of the armed forces, have been extremely positive. There's clearly work to do here. I'm not going to dress up the challenges that we've faced, but the capacity for tests has increased enormously, and we're now building the network that we need for track and trace, whether that's through the app that's being piloted in the United States.
On the app, since you mentioned it, are we developing a second app at the moment, which will be a different kind of app?
We have an app that's being rolled out on the Isle of Wight, but we are also paying attention to what's happening elsewhere in the world. This is a pilot in the Isle of Wight. We're trying to get as many people to sign up to it as possible. We have around 50,000 people who've downloaded it.
I'm sorry, can I just ask very specifically, are you looking at a second app or not?
We are learning lessons from the other apps that exist elsewhere in the world, and if we need to change our app, we will do. That's the point of piloting this before we take it national across the whole country. But I'd like to say thank you to the people on the Isle of Wight for signing up. We have, I think, around 40% of the population of the Isle of Wight who've downloaded it in a week. That's a great step forward.
One last try. Are we developing a second app or not?
As far as I'm aware, we're not developing a second app, but we are paying attention to the other apps that exist elsewhere in the world. And if we need to adapt our app or move to a different model, obviously we will do. We want the best app.
This R rate, which is a difficult thing to talk about in many ways, but it's going up at the moment, and that is because of the outbreaks in care homes. Now, we know that people have been sent to care homes from hospitals without being tested first, and we can see the results of that. But does it also mean that the rest of us are going to have to go through lockdown for longer because of what is happening in care homes?
Well, the situation in care homes has been extremely challenging. We all know that, and our heart goes out to everybody who works in care homes as well as the residents. We have a clear strategy for care homes. One element of that is a better discharge policy with the NHS, and that means that no one will go to a care home unless they are known to be free of the virus or have been either in hospital or another setting for 14 days. So that is a big step forward. We're also working on the movement of staff and people coming in and out of care homes, again, so you bring fewer people into the home and shield homes which have not yet had outbreaks. And the testing, which I spoke about earlier, will also be important because we're testing residents and staff of care homes, including the asymptomatic. But there is now a comprehensive strategy for care homes, and I want to obviously see each of the elements of that rolled out as quickly as possible.
All right, very briefly, you saw David Spiegelhalter pull on his tacky boots and jump all over your daily press conferences. Are you going to rethink as a government the way you present these numbers?
Well, I'm sure there's ways we can improve those press conferences. They continue to get large audiences, but they're designed to inform the public. If there are better ways of presenting the numbers, and I very strongly respect the professor, if we can do that, we should and will do that.
All right, Robert Jenrick, thanks very much indeed for joining us. Thanks to all of my guests. I'll be back here next week. Goodbye.